Every day, knee joints are put under a lot of physical strain. Pain in one or both knees is fairly frequent as a result of regular wear and tear, physical exercise, or injury. When a person suffers from a knee injury or strain, the pain might seem like it's burning. Burning knee pain can strike in a variety of locations on the knee. The fronts and backs of the knees are the most prevalent places where patients experience a burning feeling. The sides of the knees, on the other hand, might sometimes feel like they're burning. A burning feeling in any portion of the knee usually means there's something more serious going on that needs to be investigated and treated. Keep watching this video to learn the most common causes of burning pain in the knee, as well as how to treat burning knee pain. And if you want to get rid of knee pain for good, check out the first link in the description. 1. A torn ligament in the knee. Blunt force trauma to the outside of the knee is a common cause of knee ligament rupture. Hockey players, football players, and other contact sports players are more likely to rupture or strain their knee ligaments. Ligament rips are frequently classified by how severe they are by medical specialists. A minor tear may not need as much therapy as a serious rip. Partially torn ligaments can be treated by wearing protective knee braces or engaging in muscle strengthening exercises. 2. Chondromalacia, or runner's knee. Overuse of the knee joint results in runner's knee, also known as chondromalacia. It's especially frequent in runners and other persons who exert a lot of strain and stress on their knees on a regular basis. Chondromalacia develops when the cartilage in the knees deteriorates, leaving the joint with less cushioning. The best treatment to minimize pain and swelling and enable the knee to recover are frequently the initial stages in therapy. Resting the knee joint or applying an ice pack to minimize swelling are two options for treatment. 3. A tear in the cartilage of the knee. Knee cartilage, also known as the meniscus, cushions the joint during movements like walking, jogging, and leaping. The knee cartilage can be torn if a person receives a blunt force injury or twists it violently. This is excruciatingly uncomfortable and might feel like it's on fire. A knee cartilage injury can be treated in a number of ways. Taking pain relievers like ibuprofen and doing muscle strengthening exercises are frequently the initial steps in therapy. A doctor or healthcare team may offer steroid injections in the knee or surgical treatments if the knee cartilage does not improve. And if you want to get rid of knee pain for good, check out the first link in the description, and subscribe for daily helpful videos about knee pain. Thanks for watching.